we'll get started. Good morning, all, and welcome to Manhattan DD Council meeting on this beautiful, beautiful spring day. And I think we've finally turned the corner and put an end to the snow in the winter. Hopefully so. So we will start. For those who may be new, and I see a couple new names popping up, I am Kathy Kelly, Chair of the Manhattan DD Council. And we will start with announcements. If you have announcements to make, if you would raise your hand and use the raise hand function, and we will go through and try to get everybody in. Lynn, you had your hand up first.
Yeah, I had my hand up from before, but I do have an announcement. I'm going to be doing, let's say, monthly FIDA IDD and home care issues for people with IDD presentations over Teams. The next one I have scheduled is on March 25th at 1 p.m. And I will put a registration link in the chat. And I will put my email and contact information in the chat. If somebody wants to get that link, I can email them the registration link. I've done these presentations for some DD councils. I might have done one for Manhattan DD Council or jointly with someone from PHP. But I also assist people who are not in PHP who have issues accessing home care, especially people who are in other managed care plans, right? People with only Medicaid can be and often are in mainstream Medicaid managed care plans. I cover those people in addition to people who are enrolled in PHP.
And will it be recorded?
I do not know that I can record those. That's why I'm going to offer them monthly.
Okay.
When's the date again? I missed the date.
March 25th, 1 p.m. I did one at the end of February. I will probably make this a standing monthly gig. And of course, PHP has their own many more sessions about their offering. And I'm sure if Nick arrives, he will tell you when those are and where to find them.
Great. Thanks, Lynn. And if people can just make sure that they are muted if you're not speaking, just so that we can make sure everybody hears all this valuable information. So thanks, Lynn. Chris?
Yes, good morning, everyone. Christopher D. Grive, representing for the executive member to the Transit Riders Council, Accessibility, ACTA. I didn't know we're having music now. I didn't know that was a great entrance for me. Thank you. As I said before, ACTA, member for accessibility. Very important announcement that needs to be made for all parents, seniors, and people with disabilities. So I'm making that clear. So Ellie heard me saying the word seniors. This is for both. Please make sure that since you already updated your information, now we're up to your version of phase 1. As I'm emailed it to the Manhattan DD Council and the Manhattan Advisory Council, there is a question here that must be filled out. Do you want the Omni Card reduced fare on it as a card or a cell phone app? We need to know that, so therefore we can then in the spring coming soon. I'm surprised Jackie, I don't know. Jackie must be dying to hear from me too, but it is important, therefore, we can make sure that when we're ready to switch to the MetroCard reduced fare to the Omni reduced fare. So I'm making that clear. It is called an Omni reduced fare. That information has been emailed to both councils in Manhattan, and it was being emailed to all councils and all agencies. So please check your email. If you have not gotten it, please email me at chrisgrife@yahoo.com for transit stuff. And I'm making that clear. Also, if you have not signed up for the reduced fare card, you can also do it online, which the information is attached to the announcement as well. Now, as we reminded earlier, MTA does follow state and federal law. You still have to wear your face mask. That could be a washable mask or a paper mask. You do not have to wear an N95 mask. You can wear a washable mask that looks like this. They're available at the station booths for adults and children's size. If you do not wear a mask on the train or on the bus, I am sorry, but the fine is $50. But if you have a reason why you cannot wear it, please make sure your medical doctor has a letter with you and make sure it's stamped with his license. That's another way to be left alone. And this is including on Accessoride, subways, buses, Long Island Railroad, Metro North, and definitely Amtrak. This is federal and state law. If you have any questions, please see me on the chat and I will do that. Unless somebody has a question now, I will answer. Thank you.
Thank you, Chris. Caroline Dunn?
Hi, everybody. Caroline from YAI. So I did post in the chat our full vacancy flyer, but just to highlight a few programs, we do have openings in our crisis intervention family support program. We have openings in our day hab, our emergency respite and family reimbursement program. And we have in-home behavior management services available, as well as parent training for parents who they themselves have OPWDD eligibility. We have a skills building program called Transition to Independence. That's for persons who are not waiver eligible and are diagnosed with autism between the ages of 17 and 21. Our social skills program for persons with autism, and our U&I social and networking skills program, as well as our independent living skills program in Manhattan. Thank you.
Thank you. Ali?
Good morning, everyone. Sorry, I had to take myself off mute. I am representing Anchor Health. I am the clinical director there. We provide compassionate, skilled, person-centered home care services to individuals and families. Our home health aides are trained in crisis intervention, intellectual disabilities, mental and medical health, and are supervised by a licensed clinical social worker. They make it possible for people to live more satisfying lives in their homes, and we are Medicaid funded and are independent from OPWDD, which means that it will not affect any waiver services that they currently have. If you are interested in learning more, or you think that a family would benefit from this, please let me know. We service both children and adults, and I'll put my contact information in the chat.
Great, thank you. Wendy?
Good morning, all. Just wanted to let you know ADAPT Community Network has openings in virtually all our programs, but specifically I wanted to mention our Housing Assistance Services, Home Modifications Program, ComHab as well, and Family Reimbursement. We do have funding in our family reimbursement in all 5 boroughs. I know many of us not only support people in Manhattan, but the other boroughs as well. And the rest of the services I've put within the chat. Please contact Project Connect, which is our information and referral line, if you'd like more information or just to get the application process started for any of the services. Project Connect at 877-827-2666 or via email at projectconnect@adaptcommunitynetwork.org for those of you that are just calling in and are not on computer or tablet or phone.
Thanks, Wendy.
Thank you.
Alana?
Hi, good morning. I'm Alana. I'm from OHEL Bay Cesaro, and I just wanted to say we also have money available in family reimbursement. Manhattan, we definitely have a lot of money, and in Queens we also have. So we really want to share it with everybody and help as many families as we can. So you can call, if I put it in the chat earlier, so if you came on later, you can call 718-686-3451. Or you can email communityservices@ohelfamily.org. And we really hope that we could help everybody because time is running out. I mean, it gets quicker and quicker. You don't even realize how quickly June comes. So.
Thanks, Alana. Jacqueline?
Morning, I'm Jackie Tripodi. I'm with the New York State Institute on Disability. We too have family support funds available in Manhattan. And we also serve the other 4 boroughs as well. So we are encouraging families to submit an application for goods and services. I did put my information in the chat, but my phone number is 929-202-1115. And my email is jtripodi@nicidinc.org. Again, it's in the information is in the chat. We would very much like to assist as many families as we possibly can. Please reach out to us so that we can do so. Thanks.
Jay?
Yeah, hi. I don't know if I'm on. I'm trying to get on here. Okay. Jay Kleinman from LifeSpire. Good morning, everyone. We have openings in our Manhattan Behavior Management Program. So that's either remote or on-site. And I put the information in the chat. It's basically just shoot me an email, Jay Kleinman, just the letter J, Kleinman@lifespire.org. Okay, thanks.
Thanks, Jay. Jackie?
Are you talking to me?
Yep.
Okay.
I'm sorry,
All right.
Jackie Goldberg.
I had a question about the services through Anchor. I just wanted to know, is that alternative Medicaid program CDPAP that you're speaking of?
No, it's not. CDPAP
Okay.
is when you have a family member working there. Here, it's we provide you with the home health aid.
Okay. But you don't, I mean, CDPAP can be a family member or it can be somebody else, but that's
Yeah,
not part
so
of the program.
It's not CDPAP. It's a it's
Okay.
a different program.
Okay, thank you.
Great. Pat Lou?
Good morning, everyone. Pat Liu from GHO, General Human Outreach. GHO, we have an opening for our adult program, including day without wall, pre-vote, community-based pre-vote, and employment programs. We also have our family support service, including case management, non-Medicaid case management, to assist family who are new to the system and help them for the eligibility. And finally, we also have our family reimbursement for our goods and service for Manhattan families. We have staff speaking in Korean, Chinese, and we also have staff can do American Sign Language. And also, GHO has a contract with CDNY. We assist families speaking in Korean or Chinese to do their intake and enrollment. Okay, thank you. I will put my phone number on the chat.
Thanks, Pat.
You're welcome.
Are there any other announcements? That was all the hands raised, but anybody who has an announcement that has not gone, if you cannot use the raise hand, Johanna?
Hello, Joanna Santana from Synergia. I'm currently the Director for Family Support Services. We do have openings for evaluations for Manhattan non-Medicaid cases. We also have opening for case management, helping non-Medicaid families to get OPWDD services, as well as family reimbursement. If anything, I'm gonna put my information in the chat. You can contact me and I will gladly provide you information of the services that we have.
Great, thank you. Anyone else? You can unmute yourself if you do not have the hand raise function available.
Hi, Kathy. My name is Pam Rice. I'm from ACA.
Hi, Pam.
Hi. I just put some information into the chat. I'm the Director of Member Engagement. We have a member and family forum on March 23rd. That's next week from 4 to 5. And the topic is preparing for the ending of the Medicaid extensions, but I'm not sure if that's ending at this point. It was 2 weeks ago. So, but we will be talking about Medicaid and what that means to families and what they should be doing just in the meantime, just in case.
Great, thank you. Chris, did you have something else?
Yeah, there's a question that somebody asked me. Just want to make it clear. Yes, MTA is having Mass Force again on March 29th. I did put that in the chat because I've got at least 6 people ask me that question.
Great, thank you very much, Chris.
So just wanted one note. Yes, it's on March 29th and the link is there. They just started it as of today. So if any staff or any individual or parent with them who must be 18 years old can sign up to be volunteering to help give out masks, which is the washable or the paper mask.
Great, thanks again,
No.
Chris.
No problem.
I have two announcements, one very quick, and that is generally we meet on the third Tuesday of each month. However, next month, April, our meeting will be on April 19th.
The 12th.
I'm sorry, April 12th. April 19th would have been the third, so it'll be April 12th because of the holidays during that month. So that's that one. And then I'm sure we'll have a little bit more feedback and information later on in the meeting, but just wanted to let people know that we had our 5-borough legislative breakfast a couple of weeks ago on March 4th, and it was very well attended. Over 500, about 550 people participated, and it was a joint presentation from all of the 5 boroughs, and we hope to have that video and video and information posted on our website shortly. So thank you for all those who attended and for all the hard work that went into that. Ellie, did you have something else?
Yeah, no, pom-poms, it was spectacular. It really was very energetic. It was better in a lot of ways than in person because you could include more. I missed the in-person part of it. And I mean, not the bagels exactly, but
The muffins.
Yeah, the muffins, right. But Oscar was amazing. I mean, I think everybody was really, really amazing. Manhattan did a wonderful job, and we didn't run over like some of the other boroughs. So we didn't get heat from Staten Island, who got gypped out of their time. But anyway,
yeah.
And the video, I just passed it on to Andrew. So
excellent. Excellent.
Okay. But really, it was great energy, and it was terrific.
Yeah. And yeah, Lynn or Jim, were you going to go over this later, or do you want me to kind of highlight Manhattan's piece?
Since we're on it, you might as well continue, right? I just have one piece beforehand, though. I kept something of in the background on this one, and I'd just like to point out that that Lynn did an awful lot of work on this, and so she should be, recognized from now into the far future. Okay, so she's really good, guys.
Yeah.
Well, good, and I lucked out. It could have. There was a close thing. We didn't have one of our key videos. We didn't have until the night before, and I didn't know that Congressman Clear was going to make it until she was there. So sometimes you skate on the thin ice and you do fine. I do want to point out that we really do want to have Senator Clear in to talk to us directly after the budget season, because the Disabilities Committee does have several different program bills and items that we may want to hear about and understand before they become law, and push or say maybe, hey, not so fast on that one. Depends on what we think about them. So we're gonna make sure to do that. We probably ought to hold I don't know, maybe our May guest, if that makes sense.
Yes, and during the pandemic, we've kind of had, as you know, our meetings virtually via Zoom, and it kind of took a slight turn from our previous meetings, where at council meetings we would have guest speakers, and I think going forward we will probably start to include some guest presentations at the council, in addition to the ones that we have at our subcommittee meetings as well. So yeah, we'll see if we can set that up with Senator Claire's scheduler for either May or June. Just to recapture the breakfast, it was a 5-borough DD council event. And we kind of worked together to kind of break down the topic areas. And we had Queens start off doing focusing in on early intervention and education, followed by Bronx doing clinic services, and then Brooklyn focusing in on self-direction. Manhattan covered the areas of adult services and ComHab, and we rounded out the morning with Staten Island covering residential. Each of the boroughs incorporated speakers that represented families and providers on each of the topic areas, as well as guest speakers from the Assembly and/or Senate. We had Manhattan's piece incorporated a video from Assembly member Harvey Epstein, as well as video from a parent, Abina Smith, and I'm not sure if Abina is here today, but she did a really, really nice job, and thank her for that. We also had a video from Oscar, and for those of you who have attended our Manhattan in-person events, Oscar would be very familiar, as he has consistently volunteered as a greeter at many of our events in the past. And then we concluded our piece with an in-person presentation by Senator Cordell Clare. And so it was really good day, really good morning. And again, yes, kudos to Lynn, as well as all of the other helpers, Mary McGuire, Ellie, Jim, who were the big helpers behind this and pulling on this all together.
And we really need
go
to
ahead,
thank our family representative who spoke, Abina Smith, and I don't know if she's with us today. I'm going to check the participants list, but she, sat down and made a video recounting her family situation, and she told a nice, clear story that supported our advocacy objectives.
Yep. This was the second year we did this as a combined effort, and as Ellie said, over 500 people were there, so really had an extended reach. And it really helps in creating a unified advocacy message. So, whether we'll continue to do this going forward once in-person events resume, many of us feel that it is very worthwhile, even if we have smaller individual events, having this multi-borough effort really is worthwhile. So again, thank you to all for that. Moving on to city news, Gavin.
Right. So I just wanted to, good morning everyone. I just wanted to provide a few COVID updates. There have been a few policy changes since our last meeting. First, the Key to NYC requirement, which was a vaccine mandate for businesses, has been discontinued as of March 7th. And this is the requirement for example, restaurants. If you're going to restaurants, the requirement for a vaccine. Businesses, however, can still choose to require proof of vaccination, but it is optional at this point. In addition, the New York City Health Department is currently offering informational sessions on COVID-19 boosters for provider, staff, clients, and others. And so if this is of interest, please reach out to Shayla Rao, and I'll include her, the spelling of her name, as well as that in the chat. The email address is srao, SRAO1 @ health.nyc.gov. And as I said, I'll also include this information in the chat. In addition, she is able to speak at future council meetings if that's of interest. And in addition, I just wanted to update about the fact that the state OPWDD is distributing home test kits to residential and congregate facilities twice last month. And facilities can also order PPE, including home test kits, using Medline. And I'll include the email address for Medline, which is the system. If your organization is not already enrolled, you can contact this email address to get enrolled with Medline for PPE delivery. In addition, the health department has developed a new COVID alert system. And really this is to provide the public with information about sort of what's happening with COVID, what level of risk people can take, and sort of how to manage risk with respect to what's happening with COVID. And it includes recommendations as well. There's 4 different levels in this COVID alert system. The lowest level is green, and this means that there is low community COVID-19 spread. Currently, we are in the green alert level. So there is currently relatively low COVID community spread. And I'll include that PDF in the chat so you can read more about what the definitions are and sort of what to do, what recommendations the health department has for each level of alert. As always, if you do if you do have COVID, please follow the recommendations and that we have developed. If you are looking for a healthcare provider, we do have a phone number you can call if you're having difficulty connecting to care, and that is 212-COVID-19. And I'll include that number in the chat. And this is basically a number you can call to be connected to care. In addition, booster shots are available for ages 12 and older, as you probably know. And at this point, the vaccine has not yet been approved for under 5, but there's still a approval process going on for that. In addition, if you were recently sick or tested positive for COVID-19, you can get your booster shot after your isolation period ends. And these shots really do boost your immunity from the initial vaccine series, so they're highly recommended. We recommend currently a booster shot for any adult who received the 2nd dose of either the Pfizer or Moderna vaccine at least 5 months ago, or 1 dose of the Johnson & Johnson vaccine at least 2 months ago. And people with weakened immune systems who've received a 3rd dose of the Pfizer or Moderna vaccine should get a booster shot at least 5 months after the 3rd dose. And you can get the booster actually of any of the 3 authorized or approved vaccines. We often get this question, but we do recommend that you get either the Pfizer or Moderna vaccine unless, basically get the same one that you had gotten for your first initial series, unless there's some other reason that, you know, you have to get a different one. In terms of the other recommendations, we are recommending, you know, if you're indoors, to wear a higher quality mask, such as a KN95 or a KF94, if that's something that's possible for you. But I did want to go over a little bit about the current spread of COVID, as I always do, in terms of where cases are at. Currently, the test positivity, which is just one way we measure current COVID spread, is around 1.3%, which is decreasing for the daily average over the last week, 7 days. And we're having around 591 total cases as our daily average the past week, and 10 hospitalizations. All these numbers are actually decreasing, which is great news. And we don't yet know if this will, maintain itself or if this will, go up. But at this point, we are in a relatively low level of community spread. In addition, the percent of adults who are fully vaccinated in New York City is about 87.1%, and 88% in Manhattan. But we're continuing to seek to increase those numbers. So I'll include in the chat, places to get the vaccine, Vaccine Finder, which is a website to locate in your location. I'm sure you've seen there are so many different places to obtain the vaccine at this point, including mobile locations throughout New York City. And the other thing is that we are still doing free transportation and in-home vaccinations for anyone at this point. So if you are interested in that, I'll include how to sign up for in-home vaccination. There's a link that I'll include, as well as a phone number, if that's easier as well, 1-877-VAX-4-NYC. And that is a phone number that is you can call if you're interested in getting in-home vaccination. And as you know, there's also still currently incentives being offered for both the booster and an initial vaccine series. I think it's $100. So if this is, something of interest to people, for sure, that's, an extra added benefit. And at this point, I think those are my current updates. And so if anyone has any specific questions, let me know now. I can also include some things in the chat.
Jackie Goldberg. Unmute, Jackie.
I think that would be easy by now. My husband and I both received emails from NYU that our second booster, that we were eligible for it. So I just wanted to understand, when you say certain populations, low immunity, for a while, our group of people was kind of within that realm of special populations. And I'm trying to understand if the suggestion is now that people go and get a second booster, like people have had 2 regular ones and 1 booster, are they wanting you to get a second booster?
So if you are someone who has a weakened immune system, you can be eligible for an additional dose, but that's, it's not called a booster, it's just basically another dose. So you can speak with your physician about that in terms of whether you feel like you're at risk, and that's sort of a decision that's up to individuals with their providers. So,
Okay.
But it is something that, for individuals who have that concern can speak to them.
And how much time are they recommending be in between those 2? The last
Or you
booster?
mean between the 3rd and 4th dose?
Yes, correct, the 3rd and 4th dose.
I don't know the answer to that, but I can get back to you on that.
Okay, thank you.
Thank you, Gavin. Any other questions for Gavin? Okay, on to state news updates. James?
Hi, good morning, everyone. My comments this morning will be brief. I'm going to focus mostly on the newly released ADMs that have gone out. So there's 2 that have gone out recently. One is the Housing Subsidy Program ADM, and I will put the links in the chat to both of these ADMs. So this ADM, provides kind of more guidance and clarification on how to apply for a housing subsidy, which was previously known as ISS. And it carves out some specific guidelines around a quality assurance checklist. So, there's a requirement that a care manager work with the ISS, or the Rental Subsidy Agency, to complete a quality assurance checklist to make sure that the individual's home is safe and meets kind of all its minimum life safety requirements. There's also a participation agreement and some more guidance around the actual application for the housing subsidy. So I'll put that in the chat. Additionally, we have the family support ADM that went out, and it again has some additional guidelines around FSS. There is I believe a new cap of $3,000 annually. And I think there are particular emergency situations where you may be able to exceed that cap. But again, the ADM, I'll put the ADM hyperlink in the chat. And then lastly, I think there's a IBS ADM out for public comment. So it's in draft form. And intensive behavioral services, just as a reminder, is an HCBS waiver service. And the components of the IBS service is the administration of a functional behavioral assessment, the development of a behavior support plan, and the BSP is designed to be applicable across a range of settings. And then there's, the delivery of services up to a year's time. And again, this service is really meant to try to better understand an individual's needs that may be at risk of placement. And I would say it's an underutilized service. So, if there is interest, the care manager should be reaching out to the regional office to discuss the need for IBS. There is a special approval process through the regional office that's required. So again, if you're a care manager, for the family members on this call and individuals, if you have interest in the service, speak with the care manager who then can interface with the regional office to discuss, the application process. So I guess I'll stop there. My comments, like I said, were brief. Does anyone have any questions for me?
Margaret?
I have actually not questions, but a statement. This family reimbursement ADM was designed in a way that excluded meaningful participation from constituents. We were never allowed to see the draft ADM. We did have an opportunity to have reports on it from a very small subcommittee at the statewide family support committee. 5 people who did see it were allowed to see it, but they weren't allowed to share it. So we kind of by the back door gave our input, none of which was favorable. A few changes were made to the final ADM that resulted from our comments, but by and large, this ADM did not, was certainly not endorsed in any way by the Family Support Committee. And we remain opposed to it. So just for the record, I want you to know that there's no buy-in.
Okay, thanks for your comment, Margaret. I'll pass that on.
Okay. They do know.
I'll second that too.
I'll third it.
I'll fourth
Okay.
it. I think anybody who ever listened to a family support quarterly meeting knows that there was no listening being done at all.
And also, when the ADMs were handed down, there's 2 major factors that still haven't been sorted out as to if all agencies are going to provide all types of
right.
reimbursement and also the caps. So to me, the worst offender was you get one time in your lifetime for each type of emergency. So you can have 1 heart attack, 1 infestation of bugs, 1 somebody you love dying. I mean, this doesn't seem right to me.
Heartless is correct. It's heartless.
And you're right about the confusion. Apparently in the original ADM, they did specify that all reimbursement agencies would have to provide all reimbursement types. And there's no mention of that in this one. Gave up on that one. I don't know, but the $3,000 cap seems to be designed so that an agency can provide all types of respite, because in the version before, they were saying they would give a $3,000 cap for respite. And in addition, there was a $1,200 cap for goods and services. So that seems to have gotten all collapsed into the $3,000. It goes into effect in July, beginning of our contract year. Not so good for the rest of the state who have a different contract. And it's not clear what they're going to do with the contracts, you know, for obviously they'll have to change the number served to allow for $3,000 per person, but some contracts are pretty small. Some family reimbursement contracts are pretty small.
There were also some new parameters around having to submit the application with additional paperwork and justifications. That's still, we have to see how that's going to go. And as Mary pointed out, we want to push all the people to take their money now before the year changes, when we're still under the old rules. So
Right.
we're going to try to make a push for that.
And there's so much paperwork involved in the process now that the reimbursements are going to be delayed. Families are
Or
going to
people
have
are
to
going to
wait
give
and wait and wait.
Or people are going to give up, honestly. You know, when I read that you need to submit a life plan with an application for your $50 pants,
Which
there's
are no
greater way
longer
to shoot
eligible.
people.
You can't get $50 pants anymore because, or $20 pants,
Okay,
unless
okay.
they're directly related to the disability.
For you-
Like
for
frequent
people-
toileting accidents,
You
for
mean,
example.
you mean so it's directly related to what your brother who's not disabled would have to be, so he could feel happy going into school and being like his friends? That's like how we have to compare the pair of pants.
And families have to, you know, they have to know to include it in their life plan. If it's not
Yes.
in the life plan in section 5, then families, this is going to be a very big challenge for a lot of families.
It's
They're not
gonna
going to
put
know that
another
they need
road-
the family
right.
support services to include it in their life plan. And many care managers still don't understand
Right.
because they're on a learning curve as well. I couldn't
Mhm.
agree with all of you more.
And there was also the thing about camp that if anybody was billed for respite hours or ComHab hours, however they billed camp, that was it. You weren't eligible to do the balance through family reimbursement.
There are going to be a lot of unhappy people.
Are you getting all this down, James?
I'm taking notes, yes.
James, we can go around the screen and each put our comments in.
James, it's being recorded if you need to hear it
Yeah,
again.
Thanks, Ellie.
James, yeah, obviously, there are significant concerns in how this was done and the way it was done, including that it was not issued in draft form and stakeholder input was not sought or incorporated the way it should have been. Officially, Manhattan DD Council has objections on how this was done. And, you know, secondly, if it has not already been in the planning process, I would seriously suggest that OPWDD sponsor trainings for providers as well as family support services so that this new process can be understood and implemented appropriately or as easily as it is possible. There are significant changes in the process with this. And as you just heard, some confusion on how this affects providers as well as families. So.
Yeah, understood. Yeah, I hope that there's trainings scheduled, but I will include that in my, the information that you've shared today.
I know that there are DDRO training scheduled, but I don't know beyond that.
Okay.
Gavin, you had a question?
Oh yeah, I actually was just able to find the answer from earlier. So I can include a PDF on this as well in the chat. There's one specifically related to immunocompromised. So essentially, if you're immunocompromised, you would receive 3 doses, the initial series. And that second dose or the third dose, I should say, is different than the booster in that the dose is higher. So like for Moderna, the booster is half the dose of the initial series. So the question was about the fourth dose, which we're calling a booster. So you basically need to wait around 5 months or after for that booster shot, but you can get the booster after you've had like 3 vaccine doses, which is the sort of the protocol for immunocompromised. And it's for people ages 12 and older who are moderately or severely immunocompromised and receive a third dose, should get a booster 5 months after the third dose. So I'll include, there's a Q&A actually specifically on this topic, which I'll include in the chat as well.
Thank you.
Thanks, Kevin. IAC report, Winnie?
Hi, everybody. So, let's see. I think I'm going to tell you about the 2 one-house budgets that just came out over the weekend, and the difference between what's in the governor's proposal, what's in the 2 one-house proposals, and where we stand as far as advocacy goes going forward. So I guess I want to begin by saying that the governor's proposal was great, not perfect. We made some suggestions. We were hoping to get our suggestions into both one-house budgets, which is what Lobby Days is all about. And we did. It was really amazing. We got more than we asked for in some ways. And now we have to decide, we're in the process of doing, how to support which proposals and to move ahead really quickly, because the final budget is due on March 31st or April 1st, but it's got to be done on March 31st in order for it to be really done on April 1st. So we've got very little time and it's full speed ahead for advocacy. So the Senate, first of all, the governor put in a 5.4% COLA, which is calculated on a rolling basis for the month of July. So it's cumulative. As you probably know, the CPI, which is what it's based on, is way above 5.4% now. I believe it's 7.5. But we get the July number, you know, that's the statutory language in the budget. So governor put in the 5.4% COLA. The Senate put in a 5.4% COLA for this year, or they agreed with the governor, and they require a 5.4% COLA next year, which is really just language because this year's budget can't really dictate next year's budget, although there have been some promises made in current budgets for future budgets. So that's the Senate's stance. They also amended the $3,000 healthcare and mental hygiene worker bonus that the governor had proposed, which would be a one-time bonus for frontline staff in the 100, 200, and 300 CFR codes. So we were asking for an amendment down to 15 hours for part-time and 35 hours or full-time as deemed by the provider agency. And we were also asking for that $3,000 to be made permanent so that workers would get the bonus every single year. The Senate amended the $3,000 healthcare and mental hygiene worker bonus to address the benefits cliff, which so our lowest paid staff who are on public assistance could become ineligible because of that $3,000 bonus. So the Senate put in language so that it wouldn't be countable income toward that. And but they kept it as a one-time bonus. We were asking for the statewide healthcare facility transformation program, which is a capital program for providers. It's $450 million. We were not included except for our Article 16 clinics. We were asking for all OPWDD providers to be included, and the Senate included us. There was another provision that the governor put in about nurses across New York. It was a tuition loan forgiveness program for nurses that worked in underserved areas. They added IDD as an underserved population. So now our nurses will be eligible for the tuition loan forgiveness program, according to the Senate. They agreed with the governor's inclusion of a $50 million nonprofit infrastructure capital investment program that is also similar to the healthcare transformation fund, but for nonprofits, and we were included in that. It's only 50 million, and there's a lot of demand for that money, which is why we wanted to also be included in the other category. It adds $2 million in member items, but each house always has a few member items. Some of them are people who we know and love, and that's all really good. And it extends the credit for companies who provide transportation to individuals with disabilities and includes new language to incentivize companies to adopt accessible e-vehicles. Another good thing. And then it also, there was a Workers with Disabilities tax credit, which had expired this year. And the governor had put in her proposal to extend it for 6 years. This is for employers who hire people with disabilities. And it is somewhat useful for our employment programs. Being a person from an employment program, I got to tell you that very few employers, and those aren't the best ones, hire people because of the tax credit. But it's like, if it wasn't good enough that you're getting this, you know, excellent qualified worker, you also get a tax credit. So they avail themselves of it. So it's certainly not a bad thing. The Senate extended it for only 3 years instead of the 6 that the governor had proposed. And that's for OPWDD. So for SED, we were asking for tuition rate methodology reform, for 3 things to happen in order for our schools to get and keep the 11% the governor has proposed, which is not in her budget, but it doesn't need to be because it's according to the old methodology. And I'll stop right after this, Lynn, and answer your question. So SED, under the SED, the Senate proposed, they agree with the $1.25 million for the special education rate methodology reform. SED is asking for that to hire a consultant, and then we're very sure that they will involve stakeholders. The Senate adds language to require them to involve stakeholders in the new methodology design. The Senate also asks for the pausing of rate reconciliation for 5 years, which is one of those 3 things, and for interim plus rates beginning with the 22-23 year, which is the year coming up. We had asked for that in addition. And then they put in $10 million for special education teacher salaries, but I was not able to find that $10 million. And I think it has to do with raising minimum wage, raising salaries up to minimum wage. So that is really not something that is anything to applaud, because none of our workers should be minimum wage. Lynn, before I go on to DOH. Unmute first.
Actually, I don't have a question. Susan Williams has a question in the chat.
Oh,
I was
thank
going to
you.
add something about the Medicaid expansion with the increase in allowed income, which is in everybody's budget. So we're pretty confident it's going to happen. And I understand it, so I would spend a minute explaining it. But
Okay,
answer
perfect.
Susan's question first.
Thank you, Lynn. Let's see. I saw in print from my $3,000 bonus is approved by the Assembly for state employees only help. Okay, I'm going to get to that, Susan. It's actually not a bad thing.
Well,
That is true.
well, I mean, what about the rest of our guys who work for agencies? Winnie, waiting for your reply.
So
Bye.
when I get to the Assembly, you'll hear why. So the Senate under DOH, and I will leave a minute for Lynn to talk about her addition. They repeal the MRT 26 cut to our Article 16 clinics, which limits therapies for people who have the greatest needs. They accept the governor's proposal of a 1% across the board increase for Medicaid, which includes our Article 28 clinics and early intervention programs. They repeal the utilization thresholds that the governor put in and restored $230,000. And I actually don't understand that restoration. And I don't understand the repeal of the utilization thresholds, because that was something that would allow more people to receive services. And we're still doing some research on that one. It restores $41.2 million so that the provider prevails in the Medicaid pharmacy benefit can continue. The governor had put in her budget to discontinue provider prevails. They put in $625 million for fair pay to home care for home care workers, which would give them 150% of the minimum wage in salaries. Their salary structure is very different from ours. And it was kind of like apples and oranges with the 150% of minimum wage for our guys, since we're already above minimum wage in most cases. And so we felt that that wasn't the best way to go. And also it's actually a huge amount of money, and we're not sure where that's going to go in the final budget, although it is in both one houses. It omits the executive proposal to increase the reimbursement rate for private duty nursing, and instead establishes the state's program of all-inclusive care for the elderly. And there's more. They also eliminate, and this is what Lynn's going to talk a little more about, the Medicaid resource test, and raises the income eligibility for adults age 65 and older and people with IDD. And it omits the executive proposal on telehealth, and instead advances language to establish parity for healthcare services delivered via telehealth. And it also expands the list of telehealth providers. The governor had put in a whole section that would provide payment parity with in-person for telehealth visits. And it covered both Medicaid and commercial insurance, but it doesn't allow for payments that would be specific to capital. So it would just be the cost incurred for providing a telehealth visit, and nothing about the facility cost, which is something that we're continuing to work on. So one of the things that we asked for was the DSP refundable personal income tax credit. That was a separate bill, and it was a Senator Mannion bill, and it was not included in the Senate One House. They didn't provide any additional increase for early intervention, although we are asking for an 11% increase. And they didn't address another proposal that we had in our white paper, which would have enhanced rates for residential school CRP placements so that students could stay in state and not be placed out of state. And now, Lynn, back to the Medicaid resource test.
Okay. So the executive proposal and both of the one houses remove entirely the asset test for Medicaid for individuals. So people who have in the past had to scramble because they got a back payment when they first got SSDI, or they got some money from grandma, or they got a settlement, or what, they got cash for some reason, because these things happen. It's now they don't have to spend it within a very short window of time or put it into a supplemental needs trust. That's a huge administrative burden relief from a lot of people. It locks up what resources they have in these instruments that can be hard to get the resources back out. It also increases the allowed income to the same as expansion Medicaid applicants, which is $14.61 a month. And for that, that also solves the excess income problem for a lot of people who have more income than $920 a month. That's a lot of SSD recipients have incomes between $920 and $14.61. I want to toss out, and people could maybe write to me if they know someone in this situation. Already, if you had SSI, which is almost all of our people, except for a few who have not U.S. resident kind of statuses, who receive SSI and the Medicaid that goes with it, either they, and they do that typically when they turn 18, so that when one or another of their parents who's a covered worker retires, gets disability themselves, or dies, our person's new, probably higher income is excluded for purposes of Medicaid budgeting, and that's a great thing. But people who did not have SSI first, and most of those people are people who were still minors when that covered worker parent filed for disability, retired, or died. They don't get that exclusion of their other income. And if they don't work and use a provision called Medicaid buy-in, then they have to use a complicated and inconvenient instrument called a pooled income trust, just like many Medicare and Medicaid recipients with higher incomes who are over 65. Right. So, and the difference really is that these are people who are going to have to do this for a lot of years, and it's super inconvenient to them, their families, or whatever agency administers their benefits. If it's a residential agency, that agency is often the representative payee and the person who has to figure out all these complex financial arrangements. So huge amount of administrative relief headed our way for a bunch of people, but I have in mind a small, but I think very inconvenienced group of people who will continue to be administratively burdened for a reason that offers really no revenue savings to the state of New York. So if you know people in that situation, I'd like to identify, basically I'd like to make a list of people who would benefit from this further relief, because what is in the package is great. I've identified a set of circumstances for some people who are not going to benefit. So there are people who receive SSD in an amount over 1461, and they didn't ever have SSI. So you have to know a lot about a person. You cannot tell this by looking at them. You cannot tell this by looking at their parents. So these are people you would have to know pretty well. And I would want them to identify themselves to me if they were willing to let somebody on the health committee know, or maybe somebody at Department of Health know, that this is a category that they left out of a great fix. It's a great fix for most of us.
It would help us to know how many people are affected as well. I don't think there's any need for me to have any names, but if I could know the number of people who are affected by this, that would help our advocacy. So that's great. Thank you, Lynn. All right, so the Assembly budget proposal gives us an 11% COLA this year, which is a wonderful thing. That will allow us to do so much. And it's not just for OPWDD, it's also for OMH and OSS. And in order to pay for that, they took away the $3,000 one-time bonuses. Now they took it away, a one-time bonus, and they put it into a COLA that we're going to get every year. So that's a good deal, and we're absolutely thrilled, and we support it 100%. And they also supported the statewide healthcare transformation program, including us. The $3,000 bonuses are only for state workers. They are maintaining the $3,000 for state workers, but Susan, we would gladly trade in a one-time bonus for us for an 11% COLA that goes into the base, which would, I heard this morning that all staff salaries are about 2/3 of the entire cost of services. That's all staff salaries, not just frontline workers. So that's how much money the 11% is going to provide to agencies. And then we can really raise certain salaries. Agencies will have the flexibility to do with the money what they need to do, and including to raise staff salaries significantly. So we're really pushing for that 11%. And we can thank Assemblyman Tom Abenanti for that. We all thought he was a little optimistic when he asked for doubling the COLA. And boy, the Assembly is going for it. And it's financially viable this year because of the sweeping of that $3,000 bonus. So really good. Yep. Thank you, Tom Abenanti. Let's see. They are promoting tuition parity language for 4410 and 853 in special act schools, which is the bill language that was in the Mannion Benedetto bill that got vetoed. So that's in their one house, which is really, really good. It's not in the end what we would like, because then we're still saddled with the rate reconciliation and the cost screens the way they are, and also the interim plus rate problem, which I won't go into in this call, but so I guess what I'm pointing out is the tuition parity would be really a great thing temporarily while we're working toward a new rate methodology for our schools. They're also discontinuing rate reconciliation for 5 years. They're holding harmless for the enrollment declines of 5% compared with a 3-year period, which was prior to the pandemic, which is perfect. And they're looking at the interim plus rates in addition. And then also, of course, the rate methodology redesign, including the stakeholder input. So the Assembly supports everything the Senate supported, and they went one step further to put in the language from the bill that got vetoed. Under DOH, they're putting in an 11% increase for early intervention. So the Assembly really has us covered in all the areas. They are supporting the 1% Medicaid increase that I mentioned earlier. They're also, like Lynn was saying, for eliminating the Medicaid resource test. They are putting in $2.5 billion for fair pay to home care. So both houses are supporting that. And they also are eliminating the discontinuation of Proscriber Prevails. The Assembly also didn't support the refundable personal income tax credit that we would like to see going forward, and we're still asking for that. That's the one thing that we didn't get in either of the one house budgets that we're still going to try to ask for. And the Assembly did not support the MRT 26 repeal for the Article 16 clinics like the Senate did. And they also didn't support the enhanced rates to keep students in state instead of sending them out for the CRP opportunities. So we have a new one-click, and it's not up yet, but it will be up very, very shortly. And it's going to, we're dropping the residential things that we had been asking for, not our interest in them, but just we're taking them out of our budget discussion. And we're going to focus on, please keep these things in the Assembly and Senate one houses. Please keep these things from the Assembly, these things from the Senate. But all in all, the message is we feel very supported. There are 3 different ideas out there. These are the pieces of the 3 different ideas that we would like to see in the final budget. So we're not trashing anybody. We're really feeling the love, and we just want to make sure that we help them to choose the correct pieces from each of the ideas for the final budget for us. So the other thing that we're doing is finally there's an in-person rally, and that's going to be on the 23rd at the Capitol in Albany. And we're working on talking points right now. It'll be pretty much what I just said our letter is going to say, although the rally is for NIDA, so it's strictly on OPWDD stuff. It's not going to be for the SED or the EI, but we are absolutely thrilled and really feeling optimistic right now. And we hope you'll join us. There is a registration link in Save the Date that I'm sure Kathy has, if she hasn't sent it out already, that we would love to see you in Albany. We understand if you can't make it, and it is strictly in person, but hopefully we'll live stream it on Facebook, and you'll be able to see what we're doing. And hopefully it won't be too chilly on March 23rd because it's outside, unless it's really bad or rainy, and then we'll go inside the Capitol, but we're hoping not to do that.
Great. Thanks, Winnie. Any other questions for Winnie? Nope. And I agree. It's, for those of us who have been around for many, many, many years, even in the best of times, it has not been this optimistic. So we are crossing our fingers and continuing the advocacy until the final signatures are on the paper or electronically these days, however they're doing it.
Can I just clarification?
Sure. Yep.
First you said 5.4% COLA, and then we went to an 11%. So then I got a little, then taking away 3,000. It's a little confusing. So what?
Okay. Yes, good. Thank you for asking. So the governor proposed 5.4%, which was tied to the CPI, which is the way our COLA is devised.
Okay.
The Senate said, yes, 5.4, but we also have to give 5.4 next year. What I didn't say in my earlier presentation is that The CPI could well be over 5.4 next year in July. So tying us to a 5.4% COLA for next year is not a good idea because we could potentially get more. The Assembly said, no, not 5.4. We want to make it 11%. And in order to pay for it, we'll give up the $3,000 bonuses and put that money toward the 11% COLA. Now, the difference between the COLA and the bonus is that the bonus money was proposed as a one-shot deal by the governor. So it was something like $133 million that would be only an expense this year.
And the bonus was for the
Well,
longevity bonuses, those bonuses?
That's something else. So thank you again for that.
Right, there's so many things going out there. So what
That's
bonus
right.
was this?
The $3,000 is a brand new bonus that nobody would get yet until the budget is passed.
Okay.
And it would be $3,000 one time for, we're not exactly sure who, but allegedly 100, 200, and 300 code staff.
Okay.
The other bonuses are made possible by the American Rescue Plan money. And that money is a $500 vaccine bonus, $1,000 for what again? And then two 20% bonuses, but they're really, it's 20% during two time periods, 2 full years. One is for longevity, staying with us through COVID, and the next is for basically staying us for the year after COVID. But we know there's no year.
So
after.
those are separate to this 3,000 that, okay, fine, that's where I got, okay, fine. Great.
Exactly, and that money has just started to get out to agencies, and it will shortly be in the pockets of our staff, thank goodness. And that money is just for 200 code people. Although I know that some providers are doing their very, very best to give some bonuses to 100 and 300 code people who are deserving.
And for people who don't know, what's 100 and 300? Some family members might not know.
Thank you
what
for
that is.
that too. So 100 is like cooks and drivers and cleaners, and 300 is like nurses and speech pathologists and OT, PT, and clinical physicians.
So then they're trying to give an 11% COLA as opposed to the $3,000 bonus. Okay.
Exactly, and 11% would be on rates. So this is an overall increase, not just on salary. So it really pumps money into our services, and it's in the base so that we'll keep on getting it every single year, because that's what a COLA is. It's an actual, like a salary increase for the agencies.
Perfect. Thank you. Thank you for the clarification.
Okay, sure. Thank you for the good question.
When he just mentioned that it's also affects FIs and self-direction.
Yes. So the COLA
That'll-
affects everybody. There's a long list of it's everything. Exactly.
Lynn, did you have a question, or is your hand still raised from before?
Sorry, just didn't unraise my hand.
That's
I
okay.
do have a question. I said, are we, I noticed that both House and Senate, one house fully funded the fair pay ask from home care. And in our market, that would create a wage for them of $22.50. And wow, that's a big jump. That's going to create some distortions in the labor markets. And even to the point that some of our workforce might decide that that was more attractive work. So do we feel like that has a real chance of being funded at that wage level? I'm feeling a little skeptical that that's actually going to happen.
So I don't know. There's a real will to do it, but it does have to make financial sense too. But where there's a will, there's usually a way. And I'll say that that is justification for our 11% COLA, because we can really raise wages. We can raise wages with the 11% so that we won't be inconvenienced by a $22.50 starting wage for home care. So we can use that as, fuel for our request. That, and, state workers got a couple of big raises recently. They're also getting the $3,000 bonus. Come on, guys, that 11% would make us whole. It really would. It would put us on the level playing field that everybody wants us to be on. Jackie. You muted yourself. Still.
Jackie, again, you've muted yourself. Again, unmute.
Okay, Susan, take it easy. It's still early in the morning. Sorry about that, Winnie. What I was asking was the home care that you're saying would go up in the wages. Is that, what forum does that home care population work in? Is that the CDPAP home care? Is that another program of home care? CDPAP, yes? Because that's a huge difference.
Yeah,
That's a
it's all,
big
it's
difference.
all home care. Yeah.
Okay, thank you.
No, I mean, if their wages went up and ours couldn't, that would be bad for us. That would be terrible.
Yes, yes. It shouldn't be one substitute as the other. It should just be everybody.
Exactly, and that's the intention.
Yeah, it's a
That's
good intention.
legislative intent.
I agree. In the 4 years that I've been doing this is like the most positive things I can't speak, most positive changes that I've seen. Knock on wood.
And it ain't over till it's over. So
No, that's why I knocked on the wood.
Yeah, but we're right where we want to be right now.
Okay, thanks.
So everyone come to Albany, because
And send your
Owen.
letters. And you know what we always say, so the one click's coming out later today. You can send another letter every 24 hours and nobody's going to notice that you sent more than one. So please do. We'll send the link soon.
Or change your name. Yeah.
Great. Thanks, Winnie. Before moving on to committee reports, just one semi-committee related announcement, and that is that the executive committee of the DD Council is up for election this year. It's an election year. Yes, Ellie, it is.
Executive officer. The officer's
Executive,
not the committee.
correct, executive officers. And just to let people know, those offices are chair, vice chair, and there are two vice chair, provider vice chair and family vice chair, and secretary and treasurer. And Margaret Puddington has graciously volunteered to coordinate the nominating committee so that we will have a slate and elections by the end of this year. So just want to let people be aware of that as well.
So before you leave the
Yeah.
subject, so if people want to nominate themselves or somebody else, please send the nomination to me. I guess I can put my email in the chat. And we'll have a slate by May.
Great.
How long
And
is the
then-
position for? Did you say, is it 4 years?
2
2
years.
years.
110 years, you know.
It sometimes feels like it.
Great. And
Rousing endorsements, yes.
voting is
That's
in,
why you look so young, everyone.
isn't voting in June then, Kathy?
Oh, yes, voting is in June.
Okay.
Okay. Officially, we were supposed to have an election 2 years ago and we were hit by the pandemic. So it was just renewed for a 2-year term. But we do need to have elections this year. So thank you. And thank you, Margaret, for that.
Yeah, I'll be reaching out to a couple people to serve on this nominations committee.
Absolutely.
Okay.
On to committee reports. Manhattan Family Support Services Advisory Council, Mary or Jackie?
I'm not muted, am I, Susan?
No,
You
you're
can hear
good,
me.
Jack.
Okay, so it's been a very busy time for Mary and I. We did a guardianship workshop 2 months ago, and we got a very, very big response. And the issue that came up most was the fact that people just were having trouble getting the applications out and understanding how to fill them out. So Stephanie Barron from AHRC agreed to come back, and we did a page by page Zoom where everybody had the pages in front of them. They had been emailed and printed out beforehand. And Stephanie went through page by page by page, really well and simply with explanation, so people could fill out most of what they needed. I will say that Mary and I were a little disappointed because when we looked in the morning, we had like 6 RSVPs. But then when we looked at the registration on Zoom, because we had never done it like that before, we had 50 people. So a good almost 40 people were able to come and go through the process. And I think people learned a lot. We got a very, very positive response. And kudos to Mary because she did the bulk of the work, and it was a great, great workshop. Next up, we're going to, in anticipation of the family reimbursement rules changing, we're going to do a family reimbursement workshop so that people can submit their expenses and try to get as much of that money spent as we can before the end of the year. And I believe that is it. Mary, anything else?
Nope, we had actually 58 registrants for the
58.
partnership. Yeah. It was great.
That's great. Thank you, Mary and Jackie. Transition Committee, Andrew or David?
Sure. So last month, Transition Committee held a meet and greet with a number of different adult service provider organizations. That was well attended, and I think it was a good way to get that info out. Because the providers were so limited in time during that event, we're going to be co-sponsoring a series of longer format presentations throughout the month of April, which we're calling like Transition Month. So that information is going to be coming out soon. It'll be posted to our website and also emailed out on our email list. So hope to see you at those.
Thanks, Andrew. Family and Provider Information Committee, Yesenia or Louisa?
Good morning, everyone. This is Yesenia. We're having our meeting tomorrow. It's gonna be, it's March 16 at 10 a.m. We're going to be having Paola Martinez Boone from New York Lawyers for the Public Interest presenting on future planning. The link was, I believe Andrew pasted the link in the chat, but you can also get it at the Manhattan DD Council website at www.manhattandd.org.
Thanks, Yesenia.
I'm sorry, it's at www.manhattanddcouncil.org. And I believe Andrew just put the website in the chat as well.
Great.
That's it. Thank you.
Thanks. Legislative, I know we covered most of it, but Lynn, James, Jim or Lynn?
Yeah, I
anything?
can't think of anything else from my point of view, but go ahead, Lynn, anything? Maybe she's stuck with Jackie.
Okay, not sure if Lynn is still there. But
I have a
just
question for Andrew, and
yeah,
transition always means transitioning, well, generally means transitioning from school to adult services and stuff. But because of the pandemic and everything, has it been considered, or will you cover transitioning like from one program that used to exist one way to transitioning to something else for those of us who've been in the system a long time?
Yeah, so in this context, transition does refer to that transition from high school into
Right.
adult life, but there's definitely a point of view on it where all of life is transition. It starts with birth, ends in death, and it looks different for every person. I think in this context, that's the application because that's written into federal special education law.
Okay. Because honestly, so much has changed that at some point it would be good to take a look at everything and not blame the CCOs for not knowing anything at all.
I think we might have to kind of cast the net in a different place to catch that crowd because, we kind of target the school age transitioning.
Oh, no, I'm just saying.
folks, but I agree that's a big priority. Absolutely. Yeah, there's a need there.
Okay.
Okay.
Excuse me, I have a question
Sure,
to add
please.
in. There is also one problem that has been brought up to the MTA's end as well as accessibility. Due to the fact that they're not doing travel training, there is a problem with that going on, and it's been affecting not just in one borough, but it's affecting all of from Long Island all the way up to, I'm going to say maybe all around New York region. There is a problem because there has been no travel training, even when we had during COVID, and right now, as we speaking, there is a lawsuit going out because of that, because not just because of COVID, because of how they're not teaching proper safety. So that needs to be on a warning flag as well.
Thanks, Chris. Glenn, did you have anything else to add on the legislative front?
Not really. I mean, we as a council in past years have tried to organize travel to a rally at this time of year. Back in the Be Fair, one of the times, I think in 2016, and I rode on a bus with some of the faces I see on the screen. But I suspect that we're probably going to stick with smaller vehicle sizes and may not feel like we're able to execute on that this year as a council. But other people might know about resources and have different ideas than I do. I would just restate that after the budget is finished, we really do want to have some maybe Winnie back or somebody who can tell us about the different items that are non-budget items that are in front of the Disabilities Committee, because Senator Mannion has the healthy stack of bills he has already introduced that do different program things.
Yep. Agreed on that, Lynn. And no, we're not in a position to take large buses up to Albany this year. But again, a plug for the rally on March 23rd sponsored by NIDA. And we'll get that information posted and out later today. So just before I forget, some additional things on the legislative breakfast. We did honor and recognize Assembly Member Richard Gottfried, who is not seeking re-election after this year, for his many, many, many years of service and all of the helpful things he has done, particularly on the Health Committee. We also recognized Tom McElvanna, Executive Director at IAC, who will be retiring at the end of this year. And similar to last year, we did have a moment of silence for those people who from our community who we lost due to COVID, as well as given the current political climate around the world, a moment of silence and reflection for the for hope for peace in Ukraine. So, you know, overall, again, it was a phenomenal day. Just about 550 people attended. So it was a great morning. And again, you know, we had speakers from OPWDD, Kerry Neifeld, the commissioner spoke, Lydia Ledniak, the associate commissioner of New York City Early Intervention, gave remarks, as well as Janice Chisholm, the associate commissioner of New York City DOHMH. A little, in my opinion, a little light on, you know, some of the legislators, but from Manhattan, those that attended were Senator Cordell Clare, who spoke, Gustavo Rivera, John Mannion, Brad Hoylman, Andrew Hernandez, and Roxanne Prasad. Then we had about 5 or 6 members of the assembly speak as well. So again, kudos and thank you for all who attended. and particularly Lynn and Jim for their efforts and all the hard work that went into that. So to close out, just a reminder, there is a change of date for our next meeting. It will be on April 12th from 10 to about noon. And it will be the same link, but we'll send updated announcements on that as time gets a little bit closer. Anybody else have any other new business or questions or concerns?
So Kathy, you're going to send us something about the 23rd going up to Albany
Yes,
information
yep,
today?
yes,
Okay, we'll send out a mail chip about that. Thank you.
yep, you got it. On that note, go and enjoy the sunshine and a beautiful spring day. And happy St. Patrick's Day in 2 days.
Oh, Kelly.
Be safe and be well. Take care.
Happy birthday, Jess.
Oh, happy birthday.